Hi everyone, here's Dr. Ayushi. So after abdotanum, our medicine is acetic acid. Yes, the common name is glacial acetic acid and the group is C4H3O3. This is deep acting remedy. And the formula to remember acetic acid: dropsy, diabetes and diarrhea. Okay, I will draw something if this is necessary. Okay. Yes. Constitution is adapted to pale. This is important. Adapted to pale, lean persons with legs, flabby muscles, and constitution face is pale. Again, pale. Plexi. Okay. Acetic acid. The pale is important feature of this constitution. Okay. The medicine in bracket is ferrum. Ferrum mat. Page number 132. Go to page number 132. Mm-mm. This is ferrum mat. Page number 132. Here is also constitution. Women who are weak, delicate, chlorotic, yet have a fiery red face. Okay, in bracket you have to write acetic acid, page number 2. Here's Paramat. Women weak, delicate, chlorotic, yet have a fiery red face. And in acetic acid, the person is lacks flabby muscles. Person has legs and flabby muscle, pale and waxy. Okay. The next point of constitution is marasmus and other wasting diseases of children. Marasmus. Do you remember that in abdotanum there is marasmus of lower limbs, and in iodum there is marasmus of scrophulous diathesis, and in sanicula there is marasmus too. Here's marasmus of in sanicula. What's the marasmus point? Mm, I think neck hangs in fold. Wait, sanicula page number 270. Okay, go for page number 270. 271, I think. Yes. Emaciation. Child looks old, dirty, greasy, and brownish, and skin about neck is wrinkled, hangs in folds. Okay. And the next is tuberculinum. Uh, Losing flesh while eating well. Okay, in tuberculinum, and in losing flesh while living well, there is necromure. Okay. The next point is physical general. There is hemorrhage. Hemorrhage from every mucous outlet. Mucous outlet. Okay. For example, nose, throat, lungs, stomach, bowels, uterus. Okay, hemorrhage from every mucous outlet, and then bracket medicine is ferrum. Actually, this is ferrum phos. So this is not in this Allen's. Forget it. We go for medicine millifolium, page number 206. Millifolium, yes. The common name of millifolium is yarrow. Yarrow in Punjabi, like friends. So hemorrhage is painless. It means yarrow के पास जाते ही दर्द भूल जाना. Okay, hemorrhage without fever and painless. And hemorrhage is bright red color. In hemorrhage, fluid blood. Okay. Hemorrhage from lungs, bronchi, larynx, mouth, nose, stomach, bladder, rectum, uterus. Hemorrhage of mechanical origin. Hemorrhage of wounds. Wounds which bleed profusely. Listen, guys, listen. Wounds which bleed profusely, especially after a fall. Okay, the next point of about hemorrhage in millifolium is this. In respiratory system, hemoptysis. Hemoptysis, it means uh, bleeding. After injury, hemoptysis. In incipient thysis. What is incipient thysis? This is tightness. Hemoptysis in hemorrhoidal patients. Hemorrhoidal patients. Okay, and hemoptysis from a ruptured blood vessel. Okay, and the next point is cough. Cough with raising of bright red blood. Cough in suppressed menses or hemorrhoids. Do you remember in medicine abdotanum, page number 1, like rheumatism alternate with hemorrhoids, and in millifolium, cough with hemorrhoids, and cough with oppression and palpitation, cough after a fall from a height, and cough after violent exertion, and cough with blood daily at 4 p.m. like lycopodium. Okay. When we read millifolium, we will go for lycopodium too. Okay. Cough at 4 p.m. with blood, there is millifolium. Okay. Again, go to acetic acid. Yes. In hemorrhage, the next point is metrorrhagia. What is metrorrhagia? This is irregular menses. Irregular menses in intervals of periods. Hemorrhage, vicarious. What is vicarious? The blood of menses comes out from different body parts, different organ, except vagina or uterus. Hemorrhage, traumatic epistaxis, nose bleeding. And the medicine is arnica. Go for arnica, page number 41. Okay, we go for page, yes, page number 41. The point, eyes. Conjunctival or retinal hemorrhage. It means blood hemorrhage in eye with extravasation from injuries or cough. Okay. write page number of 2 acetic acid in arnica 2. Like when we did arnica, we will go for acetic acid. Okay. The next point of acetic acid is great prostration after injuries. Great prostration after injuries. Medicine is sulfuric acid too. Prostration, it means weak. So much tired after injuries, then go for medicine acetic acid. And and the next medicine is sulfuric acid, page number 300. Okay, go for page number 300. Yes, this is sulfuric acid. Yes. Physical general, point number 3. Weak and exhausted from some deep-seated dyscrasia. What is deep-seated dyscrasia? This is disease related to blood. Okay. Weak and exhausted, no other symptom. Only weakness and exhaustness after dyscrasia. No other symptom. Then go for medicine, sulfuric acid. And you have to write page number 2 of acetic acid. Okay. Yes. And great prostration after surgical shock, acetic acid. Great prostration after anesthetics, medicine is acetic acid. But great prostration after deep-seated dyscrasia, medicine is sulfuric acid. Okay, the next point is thirst. Thirst is intense, burning, insatiable even for large quantities in dropsy. Okay, thirst in diabetes and thirst during chronic diarrhea, but no thirst in fever. Yes, this is most important point. Okay. The next page of acetic acid, turn. Yes, this is next page of acetic acid. Yes, the point is can't sleep lying on back. Okay, can't sleep lying on back. How to remember this point? Like imagine a person who is a person on back. There is lot of acid, like acetic acid, like lot of acid. It means you can't lying on back. So you can remember this point like this in this way. Sleep better on back, arsenic, and sensation of sinking in abdomen, causing dyspnea. Sinking in abdomen. Listen, suno. Sensation of sinking in abdomen causing dyspnea. Okay. And sleep and rest better lying on belly. Okay. Can't sleep lying on back, but rest better lying on belly. Lying on belly better. Okay. Same is point. Ammonium carb. Okay. Page number 22. Go. Yes, this is page number 22. Like see amelioration of ammonium carb lying on abdomen. And here's in bracket acetic acid. You have to write page number 3. Bracket page number 3. Amelioration on painful side. Okay. Forget it. Only you have to remember amelioration lying on abdomen. Acetic acid. Amelioration lying on abdomen. Ammonium carb. Okay. Next of acetic acid point, GI system. In GI system, diarrhea. What is that? Like, I told you the formula of remembering acetic acid is 3D. Diarrhea, dropsy, and diabetes. So the point is diarrhea. Diarrhea is copious. What is copious? It means a lot of diarrhea. Diarrhea is copious, exhausting, great thirst, and diarrhea in dropsy, typhus, phthisis, and diarrhea with night sweats. This is important. Diarrhea with night sweats. So diarrhea, this is discharge, sweats, this is discharge. Okay, to discharge we need. Okay, in the next female reproductive system, there is third discharge, salivation. Okay, female reproductive system, sour belching and vomiting of pregnancy. Female में next है burning water breath and profuse salivation. Okay, this is third discharge. Day and night, this is important. Day and night. If salivation day and night, go for acetic acid and in bracket lactic acid. Okay, in this Allen's keynote there is no medicine of lactic acid. This is in boric. Okay, the next is salivation aggravation at night. Day and night acetic acid and salivation aggravation at night only, it is mercurius. Like go for page number 199, mercurius 199. Yes, female reproductive system. The point number 2, morning sickness, profuse salivation, wets the pillow in sleep. It means only at night. Okay, you have to write page number 3, acetic acid in mercurius. Yes, the next is respiratory system. In respiratory system there is true group and hissing respiration. What is hissing respiration? This is sound of these kind of sounds of hissing respiration. And cough with the inhalation. Okay, cough with inhalation, there is medicine acetic acid. Okay, and in last stages of true group, there is lot of stages of true group, and in last stage we give medicine acetic acid. And cough with inhalation and cough with exhalation, cough during morning, cough during midnight, we will read about this in spongia medicine. Okay, page number go for 287, spongia 287. Yes, this is spongia 287. Last point, like see, group anxious wheezing. Okay, true group anxious wheezing, aggravation during inspiration, aggravation. This is spongia. And during inhalation there is acetic acid, and during expiration this is aconite. And aggravation before midnight, this is spongia 2, and aggravation before morning, this is hepar. Okay, yes, aggravation during inspiration and before midnight, this is spongia. Aggravation during expiration, this is aconite. Aggravation before morning, this is hepat. And aggravation during inhalation, this is acetic acid. Yes. Okay. Inhalation of vapor of cedar vinegar. What is cedar vinegar? This is acetic acid. So inhalation of vapor of acetic acid has been successfully used in croup and malignant diphtheria. Okay. The next point is fever. Fever, hectic fever. Do you remember in abdomen there is hectic fever? Like what is hectic fever? Temperature swinging a lot. This is hectic fever. Okay. Skin dry and hot. Skin dry and hot. Okay. The important point is red spot on left cheek and drenching night sweats. Okay. Night sweats. Do you remember in diarrhea we read with night sweats, GI system diarrhea with night sweats, and here's fever, drenching night sweats. Okay, no thirst in fever. Yes, no thirst in fever. Okay, relation. The most important point of AIPGT and next exam is you have to remember relations of all the medicines. Okay, so now we study relation of acetic acid. Okay, acetic acid antidotes anesthetic vapors. Anesthetic vapors. Okay, amyl nitrosum medicine too. In amyl nitrosum medicine, these kind of symptom is written. So go for page number 25. Page number 25. Yes, page number 25. Like see, amyl nitrosum acts promptly by inhalation, resuscitates person sinking under anesthetics. What is resuscitates? Reviving someone after unconsciousness. This is resuscitates person sinking under anesthetics. This is acetic acid. So you have to write page number 3 of acetic acid and amyl nitrosum. This also acts on inhalation and under anesthetics. Okay. Yes. Again go for acetic acid. It antidotes anesthetic vapors and it antidotes fumes of charcoal and gas, and it also antidotes opium and stramonium. This is important, opium and stramonium. Okay, relation. The next point is cedar vinegar. It means acetic acid antidotes carbolic acid too. Okay, and acetic acid follows well after china in hemorrhage and after digitalis entropy. You know what? In hemorrhage condition of millefolium, like go for millefolium page number 206. Yes. This is millefolium. Yes. Millefolium follows well after aconite and arnica in hemorrhage. After aconite and arnica in hemorrhage, go for millefolium. And after china in hemorrhage, go for acetic acid. Okay. After aconite and arnica in hemorrhage, go for millefolium. And after china in hemorrhage, go for acetic acid. Okay. Okay. The next point is it aggravates the symptoms of arnica, belladonna, lachesis, mercurius, especially the headache from belladonna. This is important. Especially the headache from belladonna, it aggravates if acetic acid is given. Okay, so this medicine is complete. Now we revise the medicine abrotenum, which we studied last time. Yes, like yesterday.
Hi.
This is abrotenum. Just once. Okay, it will take only 2 minutes. So abrotenum, yes. Common name southernwood. Like my friend came from south, so this is just a trick. So you can remember by this southernwood. Family is composite. Like other medicine of composite family is millefolium, arnica, chamomilla, abrotenum. See. Okay, constitution of abdominal marasmus of children with marked emaciation. Abdominal emaciation, this is important. Especially of legs, abdominal, and in iodium there is scrofulous diathesis, and in sanicula, child is greasy, brownish, and skin neck hangs fold, and in tuberculinum there is losing flesh while eating well, and the skin is flabby and hangs loose in folds of neck, and in netromute this too, and in netromute losing flesh while living well, and in sanicula there is again skin of neck hangs loose in folds. Okay, next is mental generals of abrotenum. Child is ill-natured, and the child of sanicula is child is greasy and so much dirty. Okay, abrotenum mental, irritable, cross and despondent, violent, inhuman, would like to do something cruel. Like abrotenum child is dirty nature, but the sanicula child is dirty looking. Okay, the next is physical general. Ravenous hunger, losing flesh while eating well. While eating well, tuberculinum too, but while living well, only natromure. Okay, head in marasmus, head weak, can't hold it up, or in Athusa 2 page number 10 of Athusa, like in child can't hold his head. Okay, face of abrotenum is face old, pale, wrinkled. Okay, in opium page number 2 to 7, go for page number 2 to 7. You know what, you remember that in opium the face is dried up old man face, old man dried up. And GI system, alternate constipation and diarrhea, leontaria. What is leontaria? Undigested food particles in stool. And the next is extremities. Painful contraction of the limbs from cramps or following colic. Painful contraction of limbs from cramps and colic, like abdomen pain. The next point is rheumatism. Rheumatism for the excessive pain before the swelling, and rheumatism from suddenly checked diarrhea. Like in diarrhea, there is so much weakness and the pain in our joints started. So this is so much weakness due to this and other secretion. And rheumatism alternates with hemorrhoids. Okay, do you remember in medicine there is point of hemorrhoids? I think millefolium. Yes. Millefolium, cough with hemorrhoids, and rheumatism with dysentery. What is dysentery? This bloody stool. Like in millefolium, there is blood from anus, rectum too, and so there is in abrotenum there is blood in stool. So you can correlate these medicines. And when you read abrotenum, when you read acetic acid, go for these medicine. Revise again and again. Okay, the next page. Turn next page. Abrotenum. Like see, gout, joints stiff, swollen. Gout with pricking sensation, joints stiff. And in gout, wrist, like small joint, wrist and ankle joint, painful and inflamed. Very lame and sore all over. And marismus of lower extremities only. And the next point is fever. Great weakness and prostration. And a kind of hectic fever. Like what is hectic fever? Temperature swinging a lot with children, unable to stand. Like you remember in medicine, Ethusa, there is also great weakness and child can't hold his head. And the next point is skin. Skin itching, chilblains, agaricus. What is chilblains? Chilblains is due to cold. There is जो एरिया है वो बहुत ज़्यादा पेनफुल होता है. Okay, go for agaricus, page number 11. And skin chilblains that itch and burn intolerably. And sensation in agaricus is like as if ice touch, like ice cold needles for piercing the skin, or as from hot needles, like or ice cold needles piercing the skin. There's so much pain in agaricus, of skin of agaricus. And the next point is relation, which is very important. And in relation, after heparin furuncle, what is furuncle? It is boils or abscess. After heparin furuncle, we have to give medicine abrotenum, and after aconite and bryonia in pleurisy, we have when a pressing sensation remains in affected site. Listen, affected site, impeding respiration. So we have to give medicine abrotenum. Okay, do revise as much as possible. Do revise. Thank you. Keep watching.